Did you know that every 40 seconds, someone in the United States has a stroke? And that strokes can be preceded by warning signs that, if recognized, could save a life? What if you had the power to stop a stroke before it even happened? Welcome back to our channel today. We're uncovering the top 10 warning signs of a pre-stroke. These early indicators are crucial for intervention and prevention. Stay with us, as this knowledge could be the difference between life and stroke. Number 1. Sudden severe headache. A sudden, severe headache, often described as the worst headache of your life, can be a warning sign of an impending stroke. This intense head pain, known as a sentinel headache, can occur days before a stroke event. It's crucial not to ignore this symptom, especially if it's accompanied by other warning signs of stroke like visual disturbances, weakness or numbness on one side of the body, difficulty speaking, dizziness, or confusion. If you or someone you know experiences a sudden, severe headache along with any of these symptoms, seek medical attention immediately. Time is critical when it comes to stroke, and prompt treatment can help prevent long-term complications. Number 2. Weakness and numbness. When one side of your body suddenly feels weak or numb, it's a concerning sign. This weakness or numbness can affect your face, arm, or leg, and it's often a clear indication that a stroke may be happening. If you experience this symptom, especially if it comes on suddenly and without explanation, it's crucial to seek medical help immediately. Time is of the essence when it comes to treating a stroke, so don't delay in getting the care you need. Number 3. Trouble speaking or understanding. Difficulty speaking or understanding speech can be a concerning sign that something is amiss, especially when it occurs suddenly and without apparent cause. Slurred speech, trouble finding the right words, or difficulty understanding what others are saying could indicate a problem with brain function, such as a stroke. It's crucial not to dismiss these symptoms as mere confusion or tiredness, as they may be early warning signs of a medical emergency. If you or someone you know experiences difficulty speaking or understanding, it's essential to seek immediate medical attention to determine the cause and receive appropriate treatment. Time is of the essence when it comes to addressing potential stroke symptoms, so don't delay in getting help. Number 4. Vision problems. Sudden vision problems, such as blurred vision, double vision, or even loss of vision in one or both eyes, should never be ignored. While it's common to experience occasional blurriness or visual disturbances, especially as we age, sudden and persistent changes in vision can indicate a more serious issue, such as a stroke. These vision changes may occur suddenly and without warning, and they can significantly impact your ability to see clearly. If you notice sudden vision problems, it's essential to seek medical attention promptly, as they could be a sign of reduced blood flow to the eyes or damage to the visual centers in the brain. A thorough evaluation by a healthcare professional can help determine the cause of your vision changes and guide appropriate treatment. Remember, early intervention is crucial when it comes to addressing potential stroke symptoms, so don't hesitate to seek help if you experience sudden vision problems. Number 5. Dizziness or loss of balance. Experiencing sudden dizziness or a loss of balance can be more than just a momentary inconvenience. It could indicate a serious health concern, such as a stroke. While occasional dizziness or feeling off balance can occur for various reasons, such as dehydration or fatigue, persistent or severe episodes should not be ignored. When the brain's blood supply is compromised, it can affect its ability to maintain equilibrium and coordinate movements, leading to feelings of dizziness or instability. These symptoms may occur suddenly and without warning, making it challenging to navigate your surroundings safely. Number 6. Problems with movement or walking. Experiencing sudden difficulties with movement or walking should not be dismissed lightly, as it could be a critical indicator of an impending stroke. When the brain's blood supply is compromised, it can impair motor function and coordination, making everyday movements challenging. If you notice unexplained changes in your ability to walk or move, such as weakness, stiffness, or lack of coordination, it's crucial to pay attention to these signs. They may manifest as stumbling, dragging one foot, or difficulty maintaining balance while walking. These symptoms can occur suddenly and without warning, signaling a potential medical emergency. It's essential to seek immediate medical attention if you experience persistent or concerning difficulties with movement or walking. A healthcare professional can conduct a thorough evaluation to determine the underlying cause and provide appropriate treatment. Early intervention is key to minimizing the risk of further complications and optimizing recovery. Number 7. Fainting or seizure. Experiencing fainting or having a seizure are serious events that demand immediate attention, as they could be precursors to a stroke. Losing consciousness or having a seizure may indicate that there is a disruption in the brain's blood flow, potentially leading to a stroke. If you or someone you know experiences fainting or a seizure, it is essential to seek immediate medical attention. A healthcare professional can conduct a thorough evaluation to determine the cause of the episode and assess the risk of a stroke. Prompt medical intervention is crucial for preventing further complications and ensuring appropriate treatment. Your health and safety should always be a top priority, so don't hesitate to seek help if you experience these symptoms. Number 8. Nausea or vomiting. Experiencing nausea or vomiting without an apparent cause could be a warning sign that a stroke might be imminent. While these symptoms can be caused by various factors, including gastrointestinal issues or food poisoning, they can also indicate underlying problems with blood flow to the brain. When the brain's blood supply is compromised, it can trigger feelings of nausea or lead to vomiting. Therefore, it's essential not to ignore these symptoms, especially if they occur suddenly and are accompanied by other warning signs of a stroke. If you or someone you know experiences unexplained nausea or vomiting, it's crucial to seek medical attention promptly. A healthcare professional can assess the situation, perform necessary tests, and determine the appropriate course of action to address any underlying health concerns. Taking swift action can help prevent complications and ensure the best possible outcome. Number 9. Confusion or memory loss. Experiencing sudden confusion or memory loss should not be dismissed as mere forgetfulness. It could be a sign that a stroke is imminent. When the brain's blood supply is compromised, it can affect cognitive function, leading to confusion, disorientation, or memory lapses. These symptoms may manifest suddenly and significantly impair a person's ability to think clearly or recall information. It's essential to recognize that confusion or memory loss can be indicative of a serious medical condition, such as a stroke, and requires prompt attention. If you or someone you know experiences these symptoms, it's crucial to seek medical assistance immediately. A healthcare professional can evaluate the situation, conduct necessary tests, and determine the appropriate intervention to address any underlying issues. Timely medical intervention is essential for minimizing the risk of complications and facilitating optimal recovery. Number 10. Transient ischemic ataxia. A transient ischemic ataxia, often referred to as a mini-stroke, is a crucial warning sign that should never be ignored. While the symptoms of a TIA mirror those of a stroke, they are typically temporary and may resolve within a short period. However, despite their transient nature, TIAs should be taken seriously as they serve as loud and clear sirens, indicating an increased risk of a full-blown stroke in the future. During a TIA, individuals may experience symptoms such as sudden weakness or numbness in the face, arm, or leg, difficulty speaking or understanding speech, temporary loss of vision in one or both eyes, dizziness, or severe headache. Although these symptoms may resolve quickly, they are indicative of a temporary disruption in blood flow to the brain, often caused by a blood clot or other blockage in a blood vessel. It's essential to seek medical attention immediately if you or someone you know experiences symptoms of a TIA. While the symptoms may disappear on their own, it's crucial to undergo a thorough evaluation by a healthcare professional to determine the underlying cause and assess the risk of a future stroke. Medical intervention following a TIA may include diagnostic tests, such as brain imaging scans and blood tests, to identify any underlying conditions contributing to the transient symptoms. Additionally, lifestyle modifications, medication, and preventive measures may be recommended to reduce the risk of future TIAs or strokes. Remember, a TIA is a warning sign that should prompt immediate action. Ignoring the symptoms or delaying medical care could increase the risk of a more severe stroke with potentially devastating consequences. By recognizing the signs of a TIA and seeking prompt treatment, individuals can take proactive steps to protect their brain health and reduce the risk of stroke-related complications in the future. In conclusion, being aware of the warning signs of a stroke or TIA is crucial for protecting your health and well-being. By recognizing these symptoms early and seeking prompt medical attention, you can reduce the risk of a life-threatening event and take proactive steps towards better brain health. If you found this information valuable and informative, don't forget to give this video a thumbs up and subscribe to our channel for more insightful content on health and wellness. By subscribing, you'll stay updated on the latest tips, advice, and guidance to help you lead a healthier and happier life.